Oh, hey there, it's Dee. Welcome back to another episode of Tech and Tunes. It's been a little bit of a hiatus, a little bit of a long time between drinks, and a lot has happened. We've been having some really great chats with a number of founders and CEOs, and have an excellent chat for you today as well. So if you want to see what's coming up, jump on Patreon/Tech and Tunes. But otherwise, strap on in for another journey. And I do say the word journey with intent because the theme of today's episode is none other than guide. We have an excellent playlist for you today. So stick around for the big reveal of who's going to put that together for us, what went into it, and what you can expect from the mastermind. Today we'll be chatting to the Chief Operating Officer of WeGuide, which is another great Victorian startup in the digital health space. We'll be talking a lot about patient engagement, empowerment, putting the patient back into healthcare essentially through digital means. So join me as I talk about perverse incentives, dancefloor epiphanies, and the immortal life of Henrietta Lacks with Sandy Buchanan.
I don't think we've even seen the tip of the iceberg. I think the potential of what the internet is going to do to society, both good and bad, is unimaginable. I think we're actually on the cusp of something exhilarating and terrifying.
It's just a tool though, isn't it?
No, it's not. No, it's an alien life form.
What do you think? I mean, when you...
Should we hone into it?
Let's do it. Well, I thought it would be interesting to start with a little bit about you because you've had a pretty interesting journey. It's not like you've studied like Medtronics or anything or like an MBA and then gone straight into startup land or health from that. So yeah, I mean, you seem to have like quite an entrepreneurial spirit though. And I remember like I saw you in Denmark and you're obviously doing something pretty different then. And then I started studying public health and I was talking to you about your app. I remember back in the day and I was like, okay, cool, you're doing really interesting things in health, but it never quite clicked like how much of a journey you've had. So yeah, what's the kind of thread that's taking you through there?
Yeah, good question. I think like I've just, I've always, I guess, followed my nose a little bit in terms of what's interested me and what I've been passionate about. I started off as a lawyer for like, as a paralegal for a couple of years, really didn't like that and just sort of, I think gave me a taste of what I didn't want to do work-wise. And then, it's obviously a great profession, et cetera, but I think it's one of the older professions that is perhaps a little less progressive and innovative. And then off the back of that, I studied in Copenhagen and I'd used to work in a Mexican restaurant back in Melbourne, like Mamacita. Some people might know it. It's great food. Yeah. Institution, absolute institution. And when I studied in Copenhagen, I saw a gap in the market for Mexican food. I was like, there's no Mexican food here. So I ended up, it was something in the back of my head, and I was like, screw it, I raised some capital and went over to Copenhagen to start a Mexican restaurant, which was, I think that's when you would have seen me in Copenhagen, which was pretty hilarious. And that was also a really good experience, and the restaurant went well, got in the newspapers, stuff like that. But then, competitors started like flooding the market. It was also like a really good taste in, I think I was like 26. I was pretty young, I was like very naive, like really underestimated how much effort it would be.
Optimistic,
exactly. The eternal optimist, and I still am, But it was a good taste in like, it was really hard and like, just sort of burnt out and ended up just selling it and had sort of a bit of an epiphany hanging out with mates like down in Berlin. I think I was just like traveling and then was just like this work life sort of balance thing just is out of whack for me. So like I really wanted to search for something that was a bit more yeah, I guess like, yeah, balanced. And a good friend of mine was getting into the tech industry. And I've always like loved technology and the way the world's moving and changing and things like that. So basically what I did is I then started exploring getting into tech. I taught myself like product management with online courses. We used to operate out of the Inspire 9 co-working space, which was a really cool institution down in Richmond. I think it's still going, but yeah, it had an epic heyday when we were there. That sort of like beautiful converted warehousey kind of vibe. Just great minds bumping into each other. But yeah, and then that sort of got me onto the digital health journey. Like that startup, like I think after about 3 years, we wound it up. Sadly, didn't work out, but it was still an amazing startup. We were looking to build like a safe space for people to connect around mental health. So, a social network for well-being and mental health improvement. But yeah, it's like it didn't quite work out. So like the MVPs and like we got some really good, interesting early results, but just didn't quite get there. But along the journey, it was like awesome. And then I ended up off the back of that joining a company called Curve Tomorrow that operates out of the Children's Hospital in Victoria. Like, yeah, amazing company, very proud to be there. And was brought, like with my startup experience, was brought in to help start a spin-off company with Curve Tomorrow called WeGuide, which, I'm the COO of that now. It's an awesome company. The easiest way to describe it is that it's a platform that enables healthcare organizations to build their own apps, just plug and play, basically. So a healthcare organization can jump into our admin portal and build an app for diabetes tracking and management for remote patients, just within, like, once they know how to use the system, it can be done within like a day or two. So it's just like really, I guess, empowering healthcare organizations to access more affordable and higher quality digital health solutions, because we saw a massive problem, and this is how our startup was really born, in that we were making the same app again and again and again, just like repeatedly for different researchers or for different departments within a hospital system, and that there could be like an economy of scale where you could just build an app builder basically that these organizations could use, and it would improve patient experience, improve the hospital's digital experience with their patients, and have like a lot of really good flow-ons from that.
So we know that startups always solve a problem, and in the health sector, we're lucky there are a lot of them. But this is actually huge news. So no code and low code ways of doing what you need to do are touted as one of the largest transformations in health by all of your top consulting firms, et cetera, et cetera. That's because it means that the benefits of these technologies aren't just reserved for people who can afford developers and consultants or expensive bespoke tech. If anyone can do it, then everyone can do it, and everyone can reap the rewards. So that's really cool. But I mean, going back to your experience with Curve Tomorrow, so they kind of sit across the ecosystem, don't they? They have they have relationships with a lot of different startups. So are they basically an accelerator, or what's their...
Yeah, no, good question. Yeah, so Curve Tomorrow, I think the best way to describe it would be like it's a digital consultancy. So they will, a digital healthcare consultancy. So they'll work with anyone in the healthcare space, and they'll help them solve problems, usually like looking at a digital way to approach it. So it can be anything from like, a strategy piece of a hospital will come and say, hey, we need a better way to handle our hospital admissions, like our ED's getting overwhelmed, like we're still using paper, which a lot of places are, and they're like, cool, all right, they'll sit down with them, they'll map out the problem, like, design thinking approach and analysis, and then look at the different solutions and then present, we could build an app, or you could just do this simple progressive online, like PWA, different solutions basically, and can build it. So it's kind of like end-to-end digital health services, that they offer. So it's a really cool organization that, I'd say it's like one of, if not the leading digital health consultancy in Oz, which is really cool. And the digital health space is just starting to blow up as well at the moment, which is it's awesome. And it's just so it's so needed as well. It's like, I remember like in the early days working on WeGuide, going into hospitals around Melbourne, like very large, well-known hospitals, and they're all the like physio team are just all using paper and like paper records for all of their patients, paper surveys, paper questionnaires. And one of the first projects we worked on was helping their physio department transform that and start to send out like messages and digital prompts, and hospitals are starting to really understand the importance and benefit and value of getting that information from patients. But it's still really difficult to do it, right? It's like, if it's done with paper, like you send a letter out to patients, they might do it, they might not, but there's obviously like, paper, like sending them a letter and something they've got to send back to you is like an absolute pain. And so that's like that pain point, that, I guess like one of the things that's sort of what we started out solving basically, was like that prems and proms and digital transformation around that. And then WeGuide developed off the back of that.
Okay, so to give you the lowdown around proms and prems, this is information captured normally in a survey from a patient's perspective or a consumer's perspective. So proms are patient-reported outcome measures about the outcomes of their care, so the impact of that illness, their symptoms, or the side effects from the patient's perspective. And prems are patient-reported experience measures, which are about, you guessed it, your experience of the healthcare you received.
But anyway, long story short, Curve Tomorrow does a lot of different digital transformation work as well, like for different hospitals, and works with like, some of Australia's leading organizations, healthcare organizations, which is awesome. It's like, and the people in the healthcare space are just great, everyone's so passionate. It's like, just like passionate, enthusiastic nerds. It's like the best kind of people, like people who want to make a difference. And like, the doctors and the business team and like everyone you meet in it is like great. So it's like, it's a really nice space to work in and drive change.
It's like, I think when you have that tangible, or you can see that benefit of your work or the impact of your work on people's lives, but then that's married with these like really, really complex problems, these really, really big challenges that touch all aspects of society, then you've got a really special combination, I guess. Is that what you saw the key ask as, like the common denominator really from a lot of different health actors was around the proms and prems collection and analysis? Or
good question. Definitely that was like a key catalyst. So we did we actually did an accelerator program called Civic Labs. It's it's a startup Vic funded accelerator. It was really cool. We ended up winning that. It's pretty crazy because like I just started at curve tomorrow. And then Tice, like my co-founder on this WeGuide project, him and I were working on it, and we're like, hey, let's just put it into this accelerator, at this Civic Labs accelerator. And Tice was the one originally driving WeGuide, had all like the knowledge and the understanding of what it was, and him and I both interviewed for the Civic Labs accelerator, and they were like, you know, Tice was just like saying some awesome stuff, blowing them away, and we ended up getting it. But then Tice ended up moving back to the Netherlands, so we got into the accelerator. Yeah, because his partner, like, they're Dutch, and she wanted to go back home, so he had to move back. So basically, I got handed the reins, like, to running this accelerator program, and it was just like an insanely, for WeGuide, which was a company that I was in the process of both learning and pitching at the same time. Yeah, it was a really, really quick, it was a quick, amazing way to sort of like jump into head first into it. The accelerator, like the problem that they were bringing in different companies to solve was at a hospital called Western Health. So like it's the Western District's like largest catchment. It's Footscray and all the way out along the Maribyrnong. Amazing hospital. Some really, really cool people there. And yeah, it was around prems and proms. Like some of their team were like, this is ridiculous that we're still using paper, that we have no good data on our patients, that we just don't know. And it was like, we want to have these patient reported outcome measures captured routinely. Particularly in this space was physio. So, you know, like understanding how people are going around like knee and back and all those I guess, surgeries, makes a really big difference. Like how they're going 6, 9, 12 months, and having that data to sort of help inform, because sometimes it can be a bit like, you know, line ball between should you have surgery or not. And a lot of data is showing that it can be as effective as invasive surgery and, you know, getting a hip replacement or something. So it's like, I think it's like, without having a really rich data set, it's hard to know. But anyway, so that's sort of like building out that, that sort of outcomes driven data set is like a key thing that a lot of healthcare organizations are starting to focus on. And it opens up a whole nother interesting conversation as well, which is around, so within the healthcare sector, you've got this concept of, I guess, like value-based healthcare, which Australia doesn't really do. Yeah, like in America, one of the Obamacare, one of like Obama's large concepts that came through with Obamacare was around introducing value-based healthcare, which is where hospitals get funded based on the outcomes that patients receive. So like if a patient does well, or they're less readmitted less often and things like that, a hospital will have like better funding. So it incentivizes them towards, you know, giving patients a really good experience, because it's both experience and outcomes that a hospital will get measured on. And Australia does it a little bit, but it's still very much, it's not so much a value-based healthcare system, which is quite a difference. Yeah. In Australia, it's very much around like a hospital is funded based on the number of people the people they treat. So the number of surgeries they do, the number of days in beds, the number of all of that kind of stuff, which creates this strange, it can just create a bit of like a interesting dynamic where it's
perverse
like
incentive.
Yeah, exactly. Yeah. It's very eloquently put. Yeah, that's where the capturing outcome measures and experience measures is a way to sort of recenter the focus and the conversation on the patient, and like to really, and that is like a bit of a paradigm shift that's happening in the healthcare sector around like focusing more on the patient, like the person who should actually be, like the front and center of what we're like, what healthcare exists for, like how can we look after people in the best way possible that suits their needs. And like a really cool thing that a lot of hospitals are focusing on at the moment as well is around culturally and linguistically diverse communities, in particular like in Western health. So like the Western districts has a lot of cold community or culturally and linguistically diverse. And that was like one of their huge drivers, and like one of the things that they really focused on. And that's also where digital can have a huge difference. So like the WeGuide platform, for example, we're able to translate all of these prompts into 10 different languages, which means that you can actually speak with people in their language and communicate and blah blah blah. But it's like just makes things I think that's where like digital transformation can really bring about more equity and more just like make things way better basically.
Yeah, you're right, it really is a paradigm shift, because I guess traditionally medicine has been, you're right, in the hands of the expert, and it's like, well, why would I, if I tell you about the surgery, if I give you information, patient, what are you going to do with it? You don't know, you haven't done a medical degree, so just let me do my thing and I'll fix your knee and off you'll go. But I think I was listening to, I think it was Stephen Duckett from the Grattan Institute, and he brought up knee surgery as one of the interesting cases in like the argument for value-based care, because he said often, you look at a knee surgery, and even if the patient, if their goal is to be able to kneel down and do their gardening and not be in pain, then yes, you do a knee surgery, and you might take away the pain, but they're still not able to kneel and do their gardening, or vice versa. So you need to actually look at what that surgery or what the outcome is in the context of the patient's life and their goals for themselves.
Yeah. So it's cool that like there is a bit of a refocus and a shift around that. There's a really cool digital health, like futurist author, Eric Topol, who's one of his great books is The Patient Will See You Now. But he talks a lot about the future of the future of healthcare basically, and like, where it's all moving, and it's pretty wild and like really cool, like where things are going. And a lot of it comes down to, having like a really rich data set to really understand people. And so like, you map all of the different omic data. So you've got like the genome, you've got the phenome, you've got the biome, or like all those ohms, and there's a bunch of them, more than I originally thought. But and you can get that data through things like wearables, like Fitbit can capture a lot of really rich data, and then combine that with stuff like DNA testing. So like if you know what your DNA is, and then you can match that against your I guess like your daily vitals and all of this really rich data set, and like build that up, you create this like super rich data image of somebody around their healthcare. And then based on that, you can you can sort of understand, you can individualize healthcare to the next level. So it'll be like this interconnected data set world where people are now have so much information, like driven by AI and their own rich data set, that they can all of a sudden become in charge of their own healthcare. And a doctor is really just a service provider, where it's like, and can give some good advice, and that's the future. And the nurse, or like the human touch, will be the most valuable thing. Things like radiology and all that kind of stuff will get replaced by machines really quickly. And so it'll just shift it away from being like the doctor will see you now to being like the patient's in charge. And that's really interesting. But that sort of is in the future, and it's also a bit scary, right? And like people like having that much information about your healthcare and like out there, it's getting a bit like, Minority Reporty or whatever. Like, obviously, like it can go in any direction.
Well, Cambridge Analytica, I don't know if that's like still in the back of people's minds, but yeah, there's definitely trust issues. I think that
it's terrifying. And like Medibank, like what just happened there, you know, it's like, a lot of these organizations having like woefully unprotected data, like healthcare data source, it wouldn't build confidence around, I guess like digital health data and all of that kind of stuff. And that's something that we notice and we're aware of when like we're working and speaking with clients and things like that is things and shifts like that, they like impact the public conscience and like move people away from wanting to share their data or have their data available on the cloud. My health record, perfect example, so poorly explained. Everyone thought that they were just like sending their data offshore to or whatever it was. It's just, whereas the actual concept of it is great. It's that you have one place that tracks all of your important history, medical history information, you know, so you can go to a doctor in Cairns when you're on holiday and like you have an emergency surgery and they can just pull up and you can't talk because maybe you've had a heart attack in the water, but they can see that based on, you know, like when you had surgery in Melbourne 6 years ago, you were allergic to this drug and you had this reaction, so blah, 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 and they can like save your life or whatever. And it's like, that's what it is for. And like, that's the purpose. And like, that's but there is this like absolute fear around the digitization of health and like putting information out there. And like, I think there's like, it's warranted, but I also think we have to strike that balance because like the more we're able to do that, the more we can individualize care, the more we can improve it. And individualized healthcare is the best. So like, there's a lot of examples where people, like cancer treatment is a really good example where it's just like blanket, they'll treat everyone with chemotherapy, right? Or usually there's like a few different ways of treating people, but it's like often will be for certain cancers just through chemotherapy. And people with different genomes, it's now been shown, will have different recovery rates, or people react differently, and some people react really well to chemotherapy and others, and where some people really don't. And it's a good example where if you understand that, and rather than just giving everyone the same treatment, and you look at the actual genome of somebody and then map that onto the treatment, you can all of a sudden increase the likelihood of success by like, you know, many factors and things like that. And it's it's a fascinating space, really.
And full of contradictions, frustratingly, though, in that, like, you know, people have a Fitbit and people will use sleep tracking apps and period tracking apps or whatever, but then, or maybe not use my health record because I don't want the government to have access to my data for some reason, but then not ever question the cybersecurity of their GP office that is hosting, you know, the data that they've collected since they were 5 years old, going to the same GP. You know, it's like
totally
so many contradictions.
Like Google tracking all of their personal search history, like Facebook, blah blah blah,
Spotify.
and then it's Instagram, and it's like, but no, I don't want the government, who are pretty good operators, like
benevolent in our country,
in our country. Well said, and like, and really have like our best interests at heart. You'd hope so, and then we assume so.
No comment.
It's really interesting. There is such a there's like just a couple of standards there, isn't there?
Well, that brings me to my next question, because speaking of my health record, back in the day when we all got that opt-out notification, we're like, we were all going to get it, but if you don't want it, you have to send a letter back, whatever. I obviously was really excited. I was an MPH student, and I go to my GP and I'm like, just so you know, I want all of my data to be uploaded to my health record. And he goes, I don't know how to do that. So when it comes to WeGuide, I mean, obviously, like in designing these platforms, these products, it sounds like you have two big user camps in mind, where you have the patient that's being engaged, but then also you've got your clinician or your hospital organization or business, essentially. So what are the kind of challenges that you have to navigate around for either of those?
No, really good question. It's and that's why healthcare is so complex, right? Because there's so many operators. The patient, who's often the end user or the I guess your end consumer, is different to the payer, who is the government or the private health insurer or whoever it is, who's different to the customer, who's the hospital, who's buying you and then getting fund. And like, it's a very complex interweaving web of stakeholders and influences and things like that in the which is really cool. And it's like, I mean, it's complex though, and I think that's like why it's been a really difficult space for people to innovate in, because of all of those different layers of complexity. And so for us, as WeGuide, we're a business to business model. So like we sell to a healthcare organization or a researcher or a hospital, and they will use our app and they'll build their so we'll need to deal with the hospital admin staff, or like more so the procurement team, for example, and a few clinicians in the procurement process. But then we'll need to work with the next stakeholder group would be the clinicians and the admin who are actually going to use our platform and build it out and then share it with the patients. And then the next group is the patients who are actually going to be using the patient facing side of the app, and like who all of this is ultimately for their benefit, and it's it is really interesting that the ultimate goal out of all of this obviously is that a patient would use the app and have a great experience, or you'd get like a really rich data source for say like a clinical trial, so you can make a really important drug discovery or development. That's something that we have been that we've sort of been navigating, and it's been like a really interesting challenge, and I think has really for me underscored some of the serious problems in the healthcare space. Is just that how fragmented everything is. Like each hospital will operate differently, each healthcare organization will operate differently. In terms of like coding and development, there's no one simple language. They're kind of working on it now, but all of the hospital systems, they have these like crazy like languages to talk to each other. So like HL7's one of them. Anyway, I like just these random languages, but different hospitals will have different ones. Like some use FHIR, some use different electronic medical records, blah, 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 blah. So it's like, no one can really talk to each other very well. And why that exists as well is a lot of like EMR systems have an interest in keeping their systems locked down and hard to use, because they create these sort of monopoly or duopoly. Like Epic and Cerner are a bit like that. They've got this like these very closed electronic medical record. They're very closed. Like they're really hard to talk to with an API. The languages that speak which means that they have a lot of power in the hospital because everything has to be done through them, and they make huge amounts of revenue based on this closed model of, and like they base it on the fact that, it's secure, we know what we're doing, blah, blah, blah. But
if you're wondering what API means, don't worry, I've got you. It means Application Programming Interface, which is a software intermediary that allows two applications to talk to each other. Or, as I like to imagine, a tiny little robot translator that is just holding hands with everyone and making friends.
Anyway, it's like they make a lot of money out of that and like sort of playing on that, which is really interesting.
I remember seeing a Cerner implementation quote for hundreds of millions of dollars for a hospital group.
Yeah.
Hospital network.
And it's like
wow.
Yeah, it's wild. Like so expensive.
Yeah.
And the people who pick them are like, well, you can't go wrong with Cerner or Epic. Like my job's like, I'm not going to get fired. So it's like, and that's the other reason it's like super hard to innovate, is because risk aversion is, and rightly so, but like people are really risk averse in healthcare. Because obviously in healthcare, like the risks are catastrophic, or like they can be as bad as they can be, and it's and as a result they're very cautious around taking risks and jumping onto new technologies and things like that, which for us is, it makes it like quite hard to sort of push the space and be innovative in it, in the sense that it takes hospitals and organizations a really long time to sort of come around to digital. It's wild that people are still using paper like in hospitals, and it's still happening like in a lot of different hospitals that they'll prefer to use paper because it's quicker and easier than using like their terrible computer system or whatever it is, or they just don't have a computer system. And in an age where the consumer, because like also we don't tend to use the word patient really anymore, like internally, right? So it's like the consumer is wanting everything to be individualized, things to be convenient, to be engaged, to have that power, and then on top of that, for the sustainability of our actual health system, like I know that the forecast figure that's thrown around a lot is that we'll be 80 million health workers short by 2030. That's obviously globally. That's not necessarily accounting for the role of digital technologies to close that gap, but still, it's like for the sustainability of our actual health systems, we need this stuff. We need things to be taken out of clinicians' hands, and we need to be better tracking outcomes and making sure that what we're doing is right, and we should be paying for what we're paying for as a system. But what do you think? Yeah, what do you think is the main factor holding that back in Australia? Like, do you think it's the risk aversion, or it's really interesting. I think it's a combination of things. I think it's like overall risk aversion in the healthcare space. I think it's the shifting ability of our patients to actually use digital methods to engage in healthcare, and I think also the clinicians themselves shifting their shifting their willingness to adopt digital methods as well. So I think those are sort of the barriers or the major players in why it's taking so long.
Yeah. And we were chatting at a party recently about health tech, because I'm fun at parties.
That's that's the best conversation you can have at a party.
I like to think so. And you said that you were working a little bit internationally. Was that for WeGuide? Or?
Yeah. So like with WeGuide, and because Australia is obviously a very small market globally, so any Australian tech company, not just health tech, but any tech company, will really be looking at Europe and or America, or where to next kind of thing. Particularly in healthcare, Europe and America, both of those markets are about 20 times plus, 20 to 50 times larger than Oz. So that's kind of like where we're looking to have the biggest impact. And one thing with our company, and one of the reasons why I really love what we do, is we're driven by, like, we're an impact company. So our number one metric is how many lives we can positively impact, which is really cool. So Curve Tomorrow, they've got a goal to positively impact 1 billion lives, which I think is rad, and really drew me into. And the founders there are absolute legends, really passionate, cool, people who really care about making a difference, which is really nice. And so the reason WeGuide came about as a spin-off product or company was to enable a bigger impact. And because doing consulting projects, like you might impact 10,000 patients, or you might at an upper level, but it's not until you get to say a big global product that you can impact millions and millions and millions of patients. So we're hoping to use WeGuide, expand out to Europe, USA, and then also look at APAC, like our own backyard, like Australia Pacific, where there's room to make a massive impact. Like we work with a lot of people in India, for example, and there's so much impact that we could have in India, or Indonesia, or there's a lot of and a lot of these countries around like in the Asia Pacific region are actually quite adoptive of new technologies as well. So that's also potentially a really cool space. But and then America, we just won a grant with And Health, which is actually really cool. Yeah, you probably know And Health. They're awesome. Like Bronwyn and her team do really, like, they're working really hard to push the the digital health conversation in Oz, which is rad. And yeah, we just won basically where it's like an accelerator, but it's for scaling up. So they'll help us move into the USA and EU and stuff like that.
Awesome.
And it's awesome that stuff's happening, and that, you know, And Health exists, and that they're sort of starting to push that for Australia, because Australia has like a really cool digital, like a lot of potential in the digital health space. Like we're small, but we already have some like really cool companies that are making a big difference out there.
Yeah, I feel like we're punching above our weight.
Yeah,
Maybe
exactly. We probably just say, we like to think we're doing all right down here.
yeah, just all the way down here when no one else can see us. But that was going to be my next question, is like, do you find the appetite for digital solutions to be different in places like Indonesia or India, or, you know, obviously the US is going to be different, but like, what's your experience been investigating these?
Good question. So EU's more progressive. So like EU's quicker, like they're adopting stuff like way faster than Australia is. Australia's a bit of a Luddite. America's a mixed bag because you've got all the different states. So like some states are a bit more progressive than others.
Right. Germany are so progressive that they're the first in class to add digital therapeutics to their version of our pharmaceutical benefits scheme in Australia, or the PBS. So with the passing of their Digital Care Act, they are able to provide digital health applications with a reimbursement pathway. This essentially means that when you go to the doctor, instead of prescribing a literal pill or a pharmaceutical, they might deem that, you know, the illness that you're currently dealing with is better treated by and not only can your doctor prescribe this to you, but it can also be subsidized. So you have your subscription or whatever paid for by the government. Pretty cool, if you ask me. Here on Tech and Tunes, we give the people what they want. So for anyone who is wondering how you say digital health application in German, here it is.
Digitaler Pflegeanwendungen.
Beautiful.
And this whole space of digital therapeutics, that's like an awesome, a whole another world as well, which is, you know, just having these digital pills that can, just through an app, rather than taking medication, you can sort of alter your lifestyle and improve well-being and things like that, and have that prescribed by a doctor. That's all coming, which is like quite cool. Yeah. That's sort of one direction that we're really interested in taking WeGuide, is building digital therapeutics alongside researchers and clinicians, and that's like potentially a really interesting space. There's like some really cool companies that are getting into it, but it's still very nascent. Like it's super early on, you know, like, and I feel like, it'll definitely start to pop off. Soon. So it's like digital therapeutics is going to be a really interesting area.
And I guess something that relies upon like a really rich source of data, like something like WeGuide can kind of facilitate, you know, like capture of health data from a whole range of players that weren't necessarily doing it before, right?
Yeah, exactly. 100%. And with more data, like if you have an app that can give patients a great experience, educate them, and also capture really important healthcare information that helps the doctor, helps the patient. As we were saying before, you aggregate all of that data and you can build digital therapeutics off the back of evidence like quite easily, and you can accelerate transformation, which is really cool.
Cool. So have you seen anything in particular built through WeGuide or any application of WeGuide that you think is like particularly exciting?
Yeah, there's a few. Yeah, so like one study that's really awesome that we're doing is so it's called Gen V and Me. It's basically a longitudinal study of all children born in Australia over 2 years. And so we're in the middle of it, and they're enrolling families like daily, recruiting families into it. Yeah, so that's something that we're integrated with this like rich sort of tech system that they have. And yeah, it's awesome. Basically what they want to do is capture the largest data bank for child health in the world, and use that to make really important public health decisions and influence.
Amazing.
Yeah,
Yeah.
and the coolest thing about it as well is that so WeGuide can be used to capture obviously a general data set with the whole population, engage with the families, things like that. But we can also be used to drill into and get a bit more specific about, hey, let's ask all people who've said, hey, we have a history of diabetes in the family, for example. Let's ask them these questions and like drill into understanding, like sort of having a history of diabetes in the family and the impact on the kids, et cetera. It's like you can get quite specific and get like some really interesting, rich info that will hopefully change a lot of lives. So that's it's a really cool one that we're working on at the moment.
That is cool because I've done public health research, and honestly, you think that a state government at least would have a data source that has all these different indicators in it, but you have to stitch together little like local government surveys, all of these different proxy sources of information just to get like healthy eating habits and like things that like are really, really important for public health decision making and policy making and health equity, but they just don't exist at least uniformly across even one state, let alone the country. So
totally,
really
and
cool.
This is really trying to address it, and it's really and it's still hard though. It's not like it's just saying, hey, can you give us some data? Like there is that like the study's going really well in terms of people are actually being quite, and they're doing a really good job of recruiting people and things like that to make them actually, when we send them out a link to fill in data, like a lot of people are doing it, but obviously not everyone's doing it, and it's it's not easy running sort of long studies and trying to get all of this rich data, because there's also an incentive thing in it, right? It's like if somebody sends you a random survey, you've got to help them understand what they might perceive as a random survey. In this instance, not fully random, like they know about it, but it's how do you how does the patient or the end user know that it's important that they complete it, and it's important for their healthcare, and it's important. Like a lot of, like my mum, for example, like she'll never fill out a prom that gets sent to her because she's like, I don't know, why would I do it? Like, what's the benefit of it?
Yeah.
And it's which makes it really interesting. That's like overcoming that and letting people know that, hey, you do this, you're actually going to get better healthcare, or you're going to help the Australian healthcare ecosystem get better, or you're, like all this stuff. Yeah, that's an interesting problem to solve. That's sort of like, other than a financial incentive or something, or like $5 to do it, it's like it's really hard to convince people to do stuff, like to do it sometimes.
Honestly, it's like until you've been on the other end and you have to analyze survey data, you don't fully understand the importance of it. Like if you go to a workshop and they're like, rate it out of 5, I'm like, now I'm always rating that shit out of 5 because like, I've been on the other side. We're like, well, to get more government funding for this program, we need to show that people are enjoying it, that it's useful or whatever. And like,
totally.
Yeah. So that applied to healthcare, obviously, it's like an extremely important thing for people to be doing.
Totally. Yeah. It's it is interesting. It's but yeah, it's a shifting landscape, sort of bringing it. It's moving in the right direction, which is really cool. And I think it's it's really fun. Watch this space, basically.
Awesome.
Yeah.
So you've mentioned wanting to impact the lives of, what was it, 1 million people?
Well, Curve tomorrow is $1 billion.
Curve is $1 billion.
Yeah, which is quite audacious, but
I mean, why not?
Why not? Yeah, exactly.
The everly optimistic
Sandy. Tech entrepreneurs.
Yeah. So what's the dream for WeGuide, basically? Where do you really want to see this going?
Yeah, I think having WeGuide operate across globally would be really cool. I think that's really exciting, and it being the leading provider of digital patient experiences across healthcare organizations globally, is where we'd like to take it. Basically just like really helping hospitals give patients a really good experience using a digital method, whatever it is, and it being super easy to use, that we're using it across hospitals from New York through to Lagos through to any city or town across the world. That is I guess like the dream vision.
Sweet. I cannot wait to watch that happen.
Yeah. Fingers crossed.
Awesome. Yeah. Absolutely. And actually, just for myself, like, I'm really curious about a day in the life of Sandy as COO. Like, I think it's really cool because you have that strategic lens, but then you also have the you're on the tools a little bit.
Get shit done.
Yeah, but like, what does your week or day look like?
Yeah. No, good question. So I guess I'll start a Monday off. I'll map out my week. I'll have a couple of strategy hours in the morning, map out the week. Then, because in my role, I'm in charge of finances, operations, and also looking at culture and HR across the company, and I guess general operations and getting shit done kind of thing. But so a lot of that will entail delivery, and delivery is everything from support and blah blah blah. But anyway, so dealing a lot with clients. So I'll sort of work on customer success strategies and working with clients. So that might take up a good chunk of the days. Sort of managing our different onboardings that we have, different clients that are coming on to use the system. So that's one of the biggest things that we're focused on. But then it's all the way through to also managing support. So if there's a big issue or a bug and it's a dumpster fire because it's just created a whole lot of chaos somewhere, I'll have to focus on that. So that'll shift my attention, and then I'll look at our finances and have to manage our invoices and cash flow forecasts, and looking at things for our investors and stuff like that. So it's kind of it's a very dynamic role in that sense, doing lots of different things. And so day in the life is never the same, which is quite cool. But it's always pretty interesting. And I definitely live by the 80-20 maxim. So 80% output for 20% of the work. So I'm try to be as lean as possible, because it's in this space, particularly now that we're early, early stage and growing quickly, we just need to sort of get things done, move quickly, and have that sort of lean mindset.
Yeah. Amazing. Well,
so lots of different hats, I guess.
Yeah.
Kind of juggling them around, which is
every aspect of the company.
Kind of, in different ways, which is really fun. And it's nice when you're because it just started off with, we're about 20, 25 now, and started off with 2, and it's
clients?
2 people, sorry. We're 25 people in the org, so it's
wow.
It's still early, still startup-y, but it's but
I mean, huge growth, relatively,
and watching
change.
It grow over that time, and how we operate, and thinking back then and thinking to now. And it's I still think our processes and systems are all very juvenile, but if I actually compare it to what we used to have, which was nothing, it's interesting, watching the evolution of a company as it starts to move towards as we start to move towards more process-driven thinking and scalable thinking, really, of like, hey, we've proven something, and yes, people want it, but shit, how do we actually make this thing grow? You know, like, how can it be sustainable, and how can it be scalable? And then you have to think about all these things like, what do investors want to see? What are the key metrics that we have to show them? Which is, that's just all part and parcel, I guess, of the startup world or whatever.
This is why we love it.
Yeah, exactly. This is what we're in it for. Yay.
Yeah.
Annual recurring revenue and all that kind of stuff.
Yeah.
But it's it is. Yeah, it's an awesome role. Like, I really feel really lucky to be in it, and to work closely with really cool clients, like help them use the system and solve their patient problems. But then also, do some interesting stuff like inside the company. And we have like a really cool team. Like, everyone's awesome. So it's great, and it's fully remote as well. Like, we have an office in Melbourne, but we've got people in Melbourne, Perth, Netherlands, India, Indonesia, Pakistan, like, US, like, there's people just all over the place. So it's, which I love as well. Like, we're very, like, quite a multicultural company. Which is awesome. Just like meeting up with people all over the world, working out problems. It's cool. It's like a good day in the life.
Nice. It does.
But working from home as well, down on the coast. So like, I live in Ocean Grove. So like, I'll, do my work, but then I might, if the surf's good, I'll pop off for a couple of hours and have a wave. And it's like a really nice balance, or like way to, if things are getting a bit stressful, just jump in the water and just wash it all away. It is really nice.
Very jealous.
Yeah, but I'm sure you'll be running your own company soon, Danny.
Watch this space.
Yeah.
So while I go off and plan my own world domination, we've come to the tunes part of Tech and Tunes, where guests contribute to a themed playlist for their episode. So today we have a musical genius by the name of Adam Simmons. And I actually met Adam working in data analytics at a Big Four consulting firm. But hold on for a moment while I roll out the red carpet for these music credentials. Adam is the editor of Dingo Jazz magazine. He makes music from jazz to blues to techno. He plays with Indian and Chinese musicians and is involved with a few recent album releases, including Ella Hooper and Dan Warner. He plays in his own jazz trio with some Chinese influence and also some folk influence with Laura Carbo. They're called Origami. So basically, he just knows way more music than we do, and I thought would approach the theme in quite a unique way, and wow, did he not disappoint. This one is a journey along a spiritual yellow brick road for your ear holes. So we'll hear from Adam in a second, but first, Sandy actually has a magical recommendation for us, and a great lesson in medical history. But I would love to know if you have like a song or an artist or an album reco within the theme, guys.
Yeah. So I actually went with Nina Simone Baltimore.
Ooh, okay.
Yeah. And the reason I went with that is it's a bit more abstract. It's a great tune. Like, I love Nina Simone. But so one of the best books I've read about health and like the shifting landscape of health and health rights and where it needs to go is The Immortal Life of Henrietta Lacks, and it's a really interesting story. I highly recommend reading the book, about a woman of color from basically was going to Johns Hopkins University in Baltimore and essentially had her cells taken, and her cells have formed what's called the HeLa line of cells, which is basically like, the endlessly reproducible cell that they use in almost all like labs across the world. And this family's just like, obviously never saw a cent of it, and it sort of kicked off this whole fascinating dialogue and discussion around health rights and what people like basically like the ownership and access and inequality and all of that kind of stuff. And I think like, that's obviously where things were. And I think it's like really important that like the guiding light of the future is like moving in, in an opposite direction. And I think, ethics and things like that are starting to catch up. So yeah, anyway, it's sort of a random tangent, but it's,
No, that's an amazing interpretation of the theme. I had never considered that, but yeah, you're right. I have heard of the kind of ethical issues surrounding the cell culture, but yeah, I didn't know.
Yeah, good book, worth a read. Yeah, it's like very, very well written and researched. It's just sort of going and hanging out with like, obviously it was like years later, and the person who like Henrietta was dead, but like meeting the family and the impact that it's had on them, and like all this kind of stuff. Yeah, really interesting.
Wow.
But anyway, only hopefully upwards from here. And we'll, like WeGuide, hopefully we can guide people in the right direction away from that as well.
Absolutely. It sounds like you are, for sure.
Yeah, value-based healthcare.
Exactly.
Yeah.
Patient empowerment.
Patient-centric. Yeah.
Exactly, yeah. Sweet. Well, I think that's a really good place to wrap it up. But thank you so much for sparing a huge chunk of your time on a weekend.
No, pleasure. We love we love talking digital health at a party or on a Sunday arvo.
And I can stop harassing you to come on the podcast now.
Oh, it's an absolute pleasure. Bring me back. Yeah.
Sweet. Okay, cool. Well, I'll let you get back to your evening, but I'll chat to you very soon, no doubt.
Awesome. Cool. Thanks, Annie. Cheers.
Thank you. All right, don't go anywhere just yet. We're about to hear from Adam about how he put together the playlist and the absolute treat that you're in store for. So stick around.
So, how did I approach the theme? Well, I just simply started out with the idea of guide, but that just immediately led me to lots of meditation music, religious music. And it didn't seem to immediately lend itself to various sub-themes, but I just figured I may as well embrace it, go with the flow. So it was just kind of starting out, simply looking for guide, trying to think of a couple of things, things pop up like show me the way, hold your hand, trying to think of those things where, yes, there is that support, guidance. Sometimes it was in the lyrics, sometimes it was the title of the song. In one instance, it was, or more than one instance, it was maybe the name of the album. An example of Yusundor's album, The Guide, which has 7 seconds with Nina Cherry, which that, I just love the song, and that gave me a good reason to sort of include it. A kind of overarching thing I used was Guide, the soundtrack for a vintage Bollywood movie. It's the story of a guide and a journey through many things in that kind of epic Indian tale. And so using that to just sort of a couple of points through the playlist, for me just helped kind of honour it in a way, that the soundtrack having a story. I will be upfront that I don't understand the lyrics, but yeah, there's something just that is trying to help pinpoint, help you through the journey. It's always nice to have things to hang your hat on here and there. But sort of on a bigger level, it was also just trying to muck around, finding little cryptic connections, getting a little obtuse, I guess. Sometimes it was finding things that I knew, like Chad Morgan, and trying to find a reason why I might be able to include him. Something with the Etiquette Blues, where he's a very unlikely character to be telling you how to live your life. But then being able to pair that back to back with Grinspoon's, with a track from Grinspoon, where that's from an album called A Guide to Better Living. And so, two things around better living, etiquette, both Australian, and but totally, you probably wouldn't normally put those together. And then, another gratuitous slightly thing was putting Elvis Presley just before that. It just felt like such a fantastically weird kind of segue from one to the next. My dad would be proud of me from being able to go to Elvis Presley through to find a way to get to Chad Morgan. But then, Elvis, I feel like the gospel thing that he's doing kind of comes from the authentic American gospel, which is represented here through the Five Blind Boys of Alabama. So yes, it's music that is talking about the guidance of God, but from the Five Blind Boys, if you're going to have somebody guide you, these are the Five Blind Boys to do it. And then, as a little kind of segue in between the Blind Boys and Elvis Presley, again, slightly gratuitous, is the title track from Satan is Real by the Louvin Brothers, which, it's just another... God is real, Satan is real. It's all kind of takes you somewhere. It's all about the journey. And, so being able to share this playlist, create this playlist, was to try and find ways to create a journey that both of us would be on a bit of discovery. So it's not... There's generally a reason for everything. Sometimes it's because I really love it. Sometimes it's because it's the first time I've heard it and I discovered it when I was putting it together. And then just trying to find ways to order things so that there was a kind of connection, whether it's the musical flow from one to the next, which was the paramount one, but also then sometimes those little weird cryptic connections from one to the next. So yeah, don't put it on shuffle. The idea is to listen through and be taken on quite a roller coaster at times kind of ride. There is a bit in the middle which is just about cruising, blissing out for a bit. But yeah, it's got its emotional ups and downs. But this has been a really fun project to be involved in and delighting in the kind of crazy genre jumping. And yeah, I'm hoping that you'll take the time to share this journey with me, and I hope you won't resent me too much at the end of it. So yeah, enjoy.
All right, that's what we've got for today. So go and frolic amongst the sound waves, and obviously check out WeGuide if you're interested. Check us out on socials. So we're on Instagram, LinkedIn, obviously Patreon. Drop a comment if you learnt something. We'd love to hear from you. All right, have a good one.